Welcome to Navigating Lyme Disease for patients and doctors. I'm here with Dr. Daniel Cameron. Thank you again for being here, Dr. Cameron. I sure appreciate it.
I'm certainly happy to be with you again.
Thank you. In the last episode, we spent a fair amount of time talking about children with Lyme disease, and this is going to be part two, where we get into a little bit more. And what I like to do is start this out with an overview of a case study. And so we are on chapter 6 of the book, An Expert's Guide on Navigating Lyme Disease. And we are on topic 3, which is about a teen who was very good in martial arts and ended up being in a wheelchair. Healthy 18-year-old female, skilled at Taekwondo, all of a sudden has a bullseye rash, followed by Bell's palsy. And over 4 years, she became increasingly disabled, suffering seizures, and eventually required a wheelchair. Talk a little bit about how this got solved and what the process was for this 18-year-old girl.
Well, the case study that was published was talking about an 18-year-old girl, but as often happens when you look back over time, that bullseye rash and Bell's palsy are both things that are commonly seen in Lyme. It's just that you'd be surprised how often they may sound obvious when you're treating somebody who's 18, but there are plenty of people with bullseye rashes or flat red rashes who don't get treated. Sometimes even the Bell's palsy, which gets your attention, is blamed on a virus, and they treat with steroids, treat with a antiviral medicine. So it's pretty common I've seen in practice where someone's been sick for years without an actual an answer. But over the years, she became quite disabled, had been a Taekwondo aficionado and was excellent at that. But she became disabled, suffered seizures, and eventually a wheelchair. And so the doctors went over the symptoms that she experienced. So I wanted to be able to lay out, this is where she is at 18 years of age. The symptoms have cognitive impairments. That's what we were talking about. Examples of cognitive problems like attention issues, memory problems, processing, executive functioning problems. So I would imagine that really affected also her ability to function in school. They have tactile hypersensitivity. That's what I said. The sensory system is turned up to high.
Right.
Sun sensitivity. Then there's something called an autonomic nervous system where it controls movement. So that's why they said orthostatic hypotension. There's weight loss, fatigue, couldn't sleep very well, woke up not rested, pelvic pain, difficulty urination. As you can see, this list gets bigger and bigger, but it's so often that a child has a broad range of issues. They went on and said you had headaches, peripheral neuropathy, muscle atrophy, cervical pain, hair loss, costochondritis, which is pain across the chest, and subluxation of the multiple joints. So some of the joints weren't moving properly, and generalized pain. So at that particular point, there was a broad range of issues that this teen presented with, and it was no wonder that she was that sick. And she got sick enough to end up in a wheelchair by the time she got evaluated.
And one of the things that really surprised me was that clinicians first diagnosed her with fibromyalgia. And how do we help physicians to get from this broad range of symptoms to Lyme disease? How do we help them to do that?
Well, there's often what I call door number 1, which is fibromyalgia. Door number 2 is chronic fatigue, or what they call CFSME. And door number 3 is Lyme. And so the symptoms are so often the same for all three. Maybe if they have more pains, they'll call it fibromyalgia. And if they have fatigue, it'll be the chronic fatigue type things. But the list of the symptoms are pretty much the same. So a lot of doctors will pick one of them. Now, sometimes if treating fibromyalgia works, that's fine. But often you'll find over time that door number one, fibromyalgia, door number two doesn't work, and they finally get back to Lyme disease. Well, my concern is that even if the doctor elects to say, well, that's fibromyalgia or chronic fatigue, they don't notice sometimes that, well, that patient's sick. Or what I would prefer is that they should open up the Lyme disease door right up at the beginning and make sure they don't overlook a persistent infection and overlook an opportunity to get better. This patient at some point had the warning signs of a rash and seizure, but sometimes even those simple things get overlooked. So in this case, this girl, in hindsight, kept getting other diagnoses, and of course that takes a lot of time away. The doctors are doing tests. Since it was pseudo seizures, they probably had a neurologist involved, did an EEG, which was normal, and so it's patients like this girl who seems to get lost in a system and going after diagnoses that probably ate up time. Sure, she probably got something once in a while, but to be that sick 4 years later is something so frustrating to that parent and frustrating to me, because as a doctor, I think they should have looked at it a little sooner, like much sooner than just 4 years later.
Right, right. And, the thing that fascinates me is that as awful as this must have been for those 4 years, the fact is that she's married, physically active, leading a productive life, as you say in the book. I'm just so shocked at how broad, from being in a wheelchair to being physically active, this can be with a patient.
Yeah, I thought these authors did a good job of explaining all the sidebars, all the misdirections. They even had a few more diagnoses that were entertained by different doctors. Ehlers-Danlos, which is where they have laxity of the joints, anxiety as a label. A lot of patients get who end up eventually having Lyme disease. There's also seizures caused by increased intracranial pressure. That's been talked about at porphyria. So there's a variety of diagnoses that were considered, but when they finally decided to diagnose and treat her, it was great, to take somebody who was that sick with that many different diagnoses to be able to get her back to being married and having a productive life. So I'm glad that she got better, but I'm also glad that Dr. Bransfield and Friedman shared that case study.
Really powerful. Let's move to topic 11 in chapter 6, because it's a perfect follow-on. As we've talked a number of times about how difficult this is for kids, but also how difficult it is for parents. Let's talk about the study that was done with 23 parents with Lyme disease positive children. There were all kinds of things that parents said. My youngest child, who was 10 at the time, had 2 bullseye rashes on her body. It can't be Lyme. There's no Lyme in British Columbia, is what the doctor said. What do you say to that parent in terms of how to help them or other parents going through the same situation?
Well, that was one of the categories where these Lyme patients talked about lack of knowledge. And so sometimes it's the doctor who isn't comfortable with the range of symptoms, but be surprised how many parents where they get lost in the system. This one happened to have 2 rashes, just like that rash in the first story we talked about.
Mm-hmm.
And there's also knowledge that's getting spread in Canada that they don't have Lyme, even though for years now they have ticks there, the right kind of ticks, the right kind of cases, the right kind of blood tests. And so since this was a Canadian study, it's easy to get caught up on knowledge that's kind of old, that's stale, and especially with Lyme, there's so much research coming out this book is trying to summarize so many things that have come to the forefront, and it would be helpful if patients, their families, and the clinicians to bone up on something as complicated as that.
Talk just a little bit about your understanding of the prevalence of Lyme disease in Canada.
Well, I was at a conference maybe 20 years ago where the debate was why is there so much Lyme in New York, Michigan, Minnesota, but nothing in Canada? It was almost like there's an artificial border between it. Probably in the United States, the most cases, in fact, 90% of cases seem to be in the Northeast and all the way to Minnesota, and some in California. So with so many cases, Canada, why didn't they have any? So it took a lot of courageous researchers in Canada to look for ticks and find all the stages of ticks. And they blame most of the spread on birds. Birds can fly hundreds of miles, 1,000 miles. And so at one time, they started looking at birds that were crossing the border. And they could cross the border without going through a border guard. And they were probably an average of 2 to 3 ticks. That means some birds had more ticks, some less, but an average of 2 some ticks. So they had decided there were like maybe 50 million deer ticks that were making it to Canada. And when they got to Canada, then of course some of the Canadians said, well, they can't live in a Canadian winter. There's too severe, but they certainly lived through a Minnesota winter where I grew up, and a Michigan winter. And so over time, they've found there's plenty of ticks that settle down. They make eggs. They make eggs that go to nymphs and larvae and then adults. And so they're pretty established up there. And a lot of Canadians are frustrated, just like Americans, just like people in the Northeast, is why is there so much knowledge that I can read about it on the internet, that I can read about it from PubMed, the scientific papers that doctors listen to, and how come I can read all this that somehow the doctors in their busy practices aren't aware of all of the knowledge that's coming out? So that's why these kind of conversations to try to bring everybody up to speed in the Northeast United States, across the country, and Canada.
And I imagine that one of the reasons a lot of physicians don't know this information is that they don't find Lyme in their specialty. Is that a fair statement? In other words, they're not running across articles about Lyme because of whatever their specialty is. That's what they tend to read about.
Yeah, I find that that I have a habit of reading more Lyme than some of the other articles. But there's so many things that happen in Lyme that take me over to heart, like the dysautonomic issues, the blood pressure issues, all the neurologic issues that you get from pseudoseizures, seizures, things that look like multiple sclerosis. And so the fact that I focus on Lyme means I have to sort of incorporate a lot of other type problems. Mm-hmm. But the next issue when it comes to doctors is that every doctor is seeing Lyme patients. So even though they don't read on that topic that much, is that Lyme patients show up in neurologist's office, rheumatologist, infectious disease office, pediatricians. And so even though, yes, there's people like me who read so much about Lyme and work with it, is every doctor is seeing them, and or they're being asked, well, could this be bigger than my seizure? Could this be bigger than my ADHD, my anxiety? And so these types of articles remind doctors that they may not be a specialist in that area, but it's important to look out for patients so they can make sure that somebody's addressing their Lyme disease.
And hopefully reading this book, because it's important for them to know. One of the topics that comes up a little further down is the idea of unreliable tests. And one of the parents is quoted as saying, I think this was one of the worst times for me because I found myself hoping, actually praying that something would show up, that they would see something was wrong, so they had no choice to address it. It made me feel like a terrible mother who wishes for something to show up on a scan of their child. This is a really big issue in terms of testing, isn't it?
Yeah, most of the diseases that this first child presented with are not visible on a scan or on a test. And so fibromyalgia, other than sore areas, there's not any formal tests. Chronic fatigue doesn't have formal tests. The Ehlers-Danlos. And so, Lyme disease often doesn't have any perfect tests. It's just as a clinician, if you see so many issues, is that keep Lyme on the list. Don't take that off the list first. And so Lyme has gotten to be such a problem and so common and so treatable that you can't be sitting around always waiting for a test.
And isn't part of the reason that tests are difficult to come up with for Lyme is because it presents itself in a variety of different ways?
Part of it is we don't order it in the first place. Or if you only order the Lyme test, not the Western blot, which is a specialized test, or the doctor may not order some of the co-infections, which are other infections in a tick. But if they even order it, then the CDC set the bar really high so that you have to have a certain number of bands on a Western blot, and each band represents a protein that's on a spirochete or in a spirochete. And so by requiring what they call 5 out of 10 IgG Western blot bands, or 2Ms, we'll probably talk about that later, is that often people have a positive test on a lot of markers, but not quite enough to make the CDC criteria. And so the doctors will spend a lot of time on looking and talking about the bands, how many bands, but they forget that you still have to use clinical judgment. So the patient might have only 3 markers. They'll say, yes, you don't meet the CDC criteria, but you're left hanging where the doctor takes Lyme off the list too quick.
And then what we have is parents who are dismissed by their physician. Parent says she was dismissed from countless medical appointments with doctors stating, just take some Tylenol and get on with your life. Or the lab work is normal, there's nothing else I can do. How do we help a parent to negotiate that with a physician?
Well, one of the reasons that this book is I found was important and I wanted to work with it is that, doctors and their patients, their families read about something, but this puts together topic after topic and really easy to find areas. So even if you as a patient see somebody with Lyme, you can quickly access the articles, and read more depth on that particular topic so that you can bring the case to the physician. Also, a clinician can kind of safely catch up on the literature because each page is a different topic, a different article, a different thing that's been published. And so it's really a way to skim through, see what's important to your patient that day or what's important to bring to the doctor's attention. And I think that this type of methodical breaking it down keeps you from getting lost in the internet. You got at least one place to get a better handle on the science that we know about Lyme disease.
And as we've talked about before, and it bears repeating, the beauty of the book is that every article is relatively short. I think, a few hundred words at the most?
A lot of them are down to 110 words. So I used a larger font, which meant that I had to be pretty brief, concise, and now if anybody wants to read past those 100 words, there's typically a blog where it goes into it in much more detail. It's just that they'll get the first crack at it with the article, get the essence of it, to sort of force me as a writer to be more concise. As a writer, as you know, a lot of times you got endless amount of space to write, and you just can pontificate on it. But this goal was clean, crisp, get the facts out, get the topic out, and so it's a great start for. It's also a great start for somebody that's a, father, mother, a daughter to quickly get up to speed instead of just spending all their time on the internet.
And the thing that I keep coming back to over these episodes is, if you're a parent and your child is being diagnosed with many things and being shuffled around from one physician to another, to me, that's a red flag to say, oh, maybe I should be thinking about Lyme disease. Are we on the same page that way?
Well, that's a really good point, because when you've only been sick for a week, there's a broad range of issues, and sometimes it'll just go away, 2 weeks, 3 weeks into it. But if you're finding that they're back to your office and all you come up with is chronic fatigue, or you say, well, it must be a psychiatric problem, and they're still sick, is that this kind of book, this kind of discussion says, well, before going too far, go back and maybe use clinical judgment. Don't forget Lyme disease. Don't take it off the list so quick. And that type of process is totally different than just continuing to roll over to another specialist. Say, oh, well, neurologist, and then